This video examines structures of the neck, but first we identify some structures that are familiar to you. We see first the jugular notch here at the superior border of the manubrium of the sternum, and we see laterally the clavicles on each side. And then we show the sternal angle of Louis, the junction between the manubrium and the body of the sternum. So continuing now superiorly in the midline of the neck, we see the symphysis menti, and inferior to that, we see the hyoid bone. Continuing inferiorly, we see the superior border of the thyroid cartilage, and below that, the cricoid cartilage. We mark with a red X the location of the cricothyroid membrane, where emergency airway procedure is done. Inferior to the cricoid cartilage, we mark a series of tracheal rings, and we note crossing the second and third tracheal rings is the isthmus of the thyroid. We see the lobes of the thyroid here on either side, on the right and on the left, and we see the superior aspect of the lobes extends as high as the middle portion of the thyroid cartilage. We now have Levi turn his head to the side, and we can see an important muscular landmark, the sternocleidomastoid muscle. We see its rounded sternal head here and its flatter clavicular head, and we see the top of the triangle where the sternal head and clavicular heads meet. Medial to the sternocleidomastoid, we see in red the common carotid artery dividing into external and internal branches, and then lateral to the carotid, we see the internal jugular vein, now running posterior to the sternocleidomastoid, and lateral to them, we see the external jugular, which runs superficial to the sternocleidomastoid.